insight, honest reflections, and powerful stories during the discussion. The power of we. Please give them a round of applause. We now turn our attention to one of the most pressing and promising areas in healthcare today, the sustainability. This session, Sustainability in Action, explores how healthcare institutions can lead in environmental responsibilities while maintaining excellence in care and operations. We are honored to welcome our session chairs, Colonel Binu Sharma, Senior Vice President Nursing, Max Healthcare. I request ma'am to come forward and take a seat on the dais. Mr. ANEICON Bali, Chairman, Malabar Medical College, Kochikudi and Malabar Institute of Medical Sciences. Joining them, our distinguished speakers, Dr. Alexander Thomas Sir, founder and patron, AHPI, CAPO, AMDI, Chair of Health and EHFI. Along with Dr. Alexander, may I request Sri Ganesh V. Nair Sir, Consultant, Indian Green Building Council, and Dr. Karan Thakur, Group Sustainability Lead and Vice President, Public Affairs for the Apollo Hospitals Group. Please join me in welcoming our esteemed panel with a warm round of applause.
Hello everyone, good afternoon. The stage is too far from the audience, so I take the privilege of coming a little closer. I have a co-host. Where is my co-host? Anil. I don't see him right now, but I'm sure he will join us. We've got a very, very interesting and a futuristic topic, which is green leadership for healthcare transformation. What an excellent topic chosen and given to all of us. As healthcare professionals, we are guided by a sacred promise embedded in Hippocratic oath, first do no harm. Today, I urge you to pause and reflect. Are we truly honoring that promise when the very system designed to heal are now contributing to harm? Why do I say that? Yes, the healthcare sector, while saving lives, is also responsible for 4.4% of global greenhouse gas emissions. Hospitals, our center for healing, are among the most energy-intensive infrastructures, we know that. Let me give you some real examples. Thank you, Anil, for joining us. Okay, let me give you some examples. Operating theaters run 24/7 with passive heating, ventilation, AC systems to maintain sterility. Anesthesia gases have global warming potential, thousands of times higher than CO2. Every day, we generate mountains of single-use plastics, from syringes to surgical gowns. Medical waste incineration releases toxins like dioxin and mercury into the atmosphere. Water used in sterilization and sanitation puts additional pressure on already scarce resources. Diesel generators emit harmful pollutants. This contradiction of healing while harming lies at the core of our conversation today. So this point is going to be discussed today with our eminent speakers. I'll start with our first speaker, Dr. Alex Thomas, a very, very dear colleague and healthcare expert and master in the field. In fact, he belongs to AHPI, and AHPI has been known to set up landmark areas of progress in the field of green leadership
always a pleasure to be back in my home state, Kerala, and even more privilege and pleasure to talk at a nursing event. I think, as has been repeatedly said, the nurses are the backbone of our profession. I don't think that as a community we recognize them adequately, and I always make it a point in time here when we have a nursing function. Some of you may know that I started my career in Bangalore Baptist Hospital, started as an intern and had the privilege of retiring as a director. So during my time there, I actually realized, I think most of you ladies, you have one shift in the hospital and you have 1 or 2 shifts at home. So you really admire what you are doing with the responsibilities and demanding responsibilities at home, and in addition, what you do at the hospital. And I'm talking about 4 decades of experience that I find my nursing colleagues very reliable, very mature, and very efficient. When I was in Baptist Hospital, I'm talking about almost 2 decades ago, sometimes after working hours and weekends, the hospital was in a mess. If somebody wanted to locate a patient, they had to call me, I had to make 5 or 6 calls. So we introduced this system called resident administrator, where we chose senior nurses, gave them an orientation of 6 weeks, and they were in charge of the hospital from 4 p.m. in the evening to 8 o'clock and on weekends. And when I say in charge, they took care of everything. They took care of law and order with the patient problems, they took care of the ambulance, they took care of the security. And in fact, one of the complaints that we used to get was when a patient called, nobody used to pick up the phones. So the resident administrator used to call from another number to see whether operators were alert. And in a nutshell, I think that they did a far better job than me and my colleagues in administration did, but they added so much value to the work that we did in the hospital. So I really call them angels. And later also my interaction with various other organizations. In fact, more recently we did, I was the co-chair of the committee to ANEICON accreditation in NIMANS, an institution of national excellence. We doctors in NIMANS, very resistant, did not change, but with the nurses there, it was solid, they got on board immediately, and actually they led the transformation, and I'm happy to announce that I think this is the 3rd round of accreditation in NIMANS, and they actually speak and do what they actually practice. Now, organizations like ANI, I think, are very important. As was said many times, nurses do not actually have the status that they are supposed to have. I remember I was in Australia and in the US. A nurse was an equal partner in patient management. I remember going and doing rounds with a friend of a patient who had renal failure. The nursing colleague was equally involved, advised the doctor what is to be done, and I think that at some point that should happen in India also. Because all of you, our nursing colleagues, spend so much time with the patient. And I think at some point, I think this should happen. I remember the early days of ANI. I must congratulate ANI for having coming to this level. I think it was in 2017, I think Gracie, Jyoti Clara and Rajita, where we set up the concept. HK was involved, as I said, Gani was involved, and Samir Mehta, and I think we're very proud to see, and especially proud to see that this is a conference like many other good conference. I have some regrets. I was involved in formation of AHPI, Association of Healthcare Providers, involved in Mumbai and GAHO, and if I had to start all that now with my colleagues, I'd make sure that a nurse would have been part of the founding members. But anyway, we made some amends. In the Quality Council of India, where I am in the grading committee, we have Binu Sharma, very valued member, and in health, which I'll talk about a little later, we have Rajita. And also in Mumbai is an organization of postgraduate teaching hospitals. But a few years ago, recognizing the importance of the nursing colleagues, we have introduced an annual national award for nurses. So I think with that, let me go on to the topic at hand. And talking as a healthcare professional, like you, concerned about the world we are living behind food extinction. I think we keep forgetting about that. And adopting green deals in healthcare. It's not only timely, I think it's urgent. So before that, I'll just give this reference. This is a book that we wrote on health and climate change. The first self-book in the country. It's available as a free download. Please feel free to download it and read, and if you want copies, please let me know about it. Now coming to the subject. As was mentioned, then I think the healthcare industry, we contribute 5% to the total carbon emissions in the country. And this is only increasing with the number of beds increasing. So here is the paradox. Like was mentioned earlier, the central tenet of healthcare is first, do no harm. Unfortunately, we harm the ecosystem that supports human health. We have heat waves, floods, etc. It's often nurses who face these challenges directly. These are some statistics. 2 million people and 4.3 trillion in economic damage. Now, this is in India, at least 150,000 deaths and 5 million illnesses every year. Why green healthcare needs nurse leaders? As was mentioned earlier, healthcare contributes nearly 5% of global carbon emissions. Hospitals are very energy intensive and waste heavy in India, and nurses are in the front line of care and can lead sustainability. You are available to the patient 24/7, you are the face of the healthcare. You are educators, patients, families, and the junior staff. You are advocates. You advocate influence policy and practices within your hospitals, and as well known, problem solvers, managing infections, infection control, medication safety, and resource efficiency. So what can nurses do? I think I won't go into detail, but just a sort of revision. So what you can actually do on the ground, you can segregate waste at source, ensure proper separation of biomedical and general waste, reduce plastic use. I think I was just talking about, I just heard an article this morning that plastic was converted into furniture, and in some places it's being used as roads, and the different types of waste which I mentioned here. Single-use plastic is something which is a big menace in our society. Though the laws are there, it is not being adequately implemented. Also promote sustainable procurement and promote sustainable, simple things you can do. Think green, unused equipment, turn it off when you're not using it. Support green procurement. And when you say support green procurement, I think nurses, at least in my hospital and similar hospitals, nurses are on the committee to procure different things for the pharmacy equipment. Please make sure that you are also keeping this in mind. Sustainable nutrition, you are the patient 24 hours, you are the patient during breakfast, lunch and dinner, and you interact closely with the dietitian. So sustainable nutrition is something that is also important. And of course, the opportunity you have spending so much time with the patient, and the use of technology where you don't have to, earlier I remember my nurses used to spend at least 2 hours documenting. With technology, that time is also available, where you can educate your junior staff and your patients. Just a small real example to indicate that each one of you can make a difference. This is a hospital in Maharashtra, just 3 simple changes. They switched off idle equipment, they used reusable items, and started composing kitchen waste. And this hospital resulted, these 3 simple measures, led by the nursing leadership, resulted in 10% less energy use and 1.2 lakhs in savings every month. So let me talk a little bit about what I'm doing in the climate change health space. Along with the Public Health Foundation and the Health Card Without Harm, we've started something called the Health and Environment Leadership Platform. It's a national green initiative by PHFI and Healthcare Without Harm, and it is basically to build climate smart hospitals and capacity building. This is a picture of Dr. Srinath Reddy, who was the chair of PHFI at that time, with George Carmina from the Healthcare Without Harm. So we are, in a sense, we are a sort of international organization. As I said, we have a steering committee of regional leaders. Ajita is, your president is one of the regional leads. And most recently we decided that each state will have a chapter with the patron, advisors and president and members. And in fact in Kerala he has agreed to be the patron and he has committed to Jita. And we are looking forward to a very strong chapter in Kerala. Similarly, we have chapters in all the states in the country. And this is what we do. We look at climate change, air pollution, sustainable procurement and health waste management. So please join us. Your president is part of the core group. Become a green nurse champion in your hospital. Participate in local health projects. Educate staff and track environment indicators. This is something that we will be able to assist you with and share success stories on national platform. In fact, we have a small mission hospital in Udupi which is going great guns and they're coming out with a study on what are the benefits of going green. This is something that the HPI did way beyond people started thinking of climate change in 2016. He brought out standards for clean and green hospitals. Subsequently, I also worked with the NAPH and they've introduced green standards in the 5th edition, which is now the 6th edition. And this it fairly covers most of the things that need to be implemented in a hospital. This is a meeting with the CEO of NAPH as we took this forward. Also working with the government of India, we are trying to introduce this subject into the curriculum of medical and allied health. As always, we are still talking, but our nursing colleagues have already introduced it in the nursing curriculum, but we are trying to take this forward. So takeaway message, green healthcare is not a luxury, it's an ethical imperative. I think all of you will agree with me on that. And nurses are very well suited to lead this transformation. You are naturally born leaders, you have discipline, you have maturity, you are the face of the healthcare in the country. And I think let's heal people. And I think importantly, we need to heal the planet because we have a responsibility to our future generations. So together, lead the way to sustainable healthcare. And I'm hoping that the nursing leadership and especially ANEICON will take this as one of the agendas. Thank you very much.
Thank you, Dr. Alex. Some starting facts. 2 million deaths because of extreme weather. 5 million illnesses in last few years. Nurses can transform and become the green leaders because they are care leaders, they are educators, they are policy makers, they are also the advocates. Nurses can be highly instrumental in reduction of waste, for managing single-use plastics, turning off equipment lights when not in use. They can also add for sustainable nutrition. He gave us an example of a Maharashtra nurse who was instrumental in reducing the energy levels by 10% in a hospital. He also said nurse leaders can join and contribute to green transformation, green leadership, and they can become champions. In fact, green leadership should be led by nurses in India because they are 24/7 in hospitals around 24/7. NAPH in the 5th edition has recommended and encourages green transformation. Also, JCI 8th edition has advocated a standard on green transformation in healthcare. So with that, let me invite our second speaker, Ganesh. Over to you, Ganesh. Ganesh will speak to us about green facility, right? Thank you.
Can I have
Good afternoon, ladies and gentlemen. I have a request to the people handling the sound here. Whatever is being said out here can't be heard on those seats. So I think the feedback needs to be set up properly. Otherwise, in an interactive session, the next panelist cannot really understand what we are saying here. So kindly do that so that in the next session onwards you can have good feedback. Thank you. Can I have a presentation, please? First one. So once again, good afternoon, and my name is Sri. I am an engineer, probably out of place in this session because I see that all our healthcare professionals are somewhere connected to the healthcare industry. But I'm happy to say that we are the backbone of the buildings where we work in. We are serving the industry which gives you the space, which gives you the conditioning, which gives you the power, which gives you the water, which handles the waste. So in a way, we give you the facility for you to work on and manage the patients who come into the facility. In that context, as the panel chairperson said, healthcare industry does contribute a lot to the deterioration of the climate. Now we hear the words climate change and the global warming and CO2 emissions and whatnot, but I don't know whether everybody is really aware of that. The effects of climate change are pretty much evident in our daily lives. We have what is called offset monsoons, excessively hot summers. We are now facing temperatures like 42 degrees, 45 degrees in Kerala, which is unheard of. We are having tempests, we are having cloudbursts. 3 days back we had a cloudburst in Kerala. This was not there earlier. We used to have a monsoon which was preset like June onwards we have the rains. Now, why has the climate shifted? It is because of us. It is in this context that as nurses and doctors and healthcare professionals and the healthcare industry at large, it is important to know that at the same time that you are essential caregivers and support for the entire society, you also have to make sure that the society can survive for the next 100 years, 500 years without being sick because of the healthcare industry. So in that context, I am here on behalf of the Indian Green Building Council, which is the certifying body for certifying all kinds of buildings which are in commercial, residential, healthcare and other industrial areas, and they certify and give you various ratings. You have got several rating programs for hospitals as well. So I will run through the green facilities program. A lot of it is technical jargon, so I will speed it up and probably try to explain it in a simpler way. A green building simply means use less water, optimize energy, conserve natural resources, generate less waste, and more importantly, in the context of healthcare and hospitals, give healthier spaces to the people occupying the building. Now, in that context, we will come to as we go forward, we will see the slides which are related to hospital-induced infection. So that is one great challenge which the healthcare industry is facing right now, which is not very great here. But like the United Nations came out with a paper about 3 years back and WHO had ratified it, one of the biggest causes of deaths is indoor air quality, more than mosquitoes. The deaths that are caused due to indoor air quality are higher. So the statistics are speaking for themselves. As we start enclosing ourselves into rooms like this, and as we start depending on the air conditioning systems, we are also dependent on the quality of the air conditioning system that is provided. Similarly, the visual effects, sitting on those chairs, I can't see the speaker here because of those lights. That means I am uncomfortable. So comfort has been redefined. Some people are becoming uncomfortable. The level of lighting in this room, are you comfortable? Are you able to read on your tables? So these are all things which contribute to green facilitation. Healing environment is very critical, and that is where the green certification helps you. All these put together address the national benefits which, as considerate citizens, it is our duty to ensure that national resources are not wasted, energy and water being one of the most prominent. So sustainability in healthcare facilities would be a result of combining all these activities together. There are some hospitals have made it a policy that they will be green certified or they will act on their in the level possible for them to ensure that sustainability is achieved. Ultimately, the objective is to enhance public health. Now, in the coming slides, you will see some of the hospitals which have walked the talk and they have gone to IGBC and got themselves certified. The certification process itself will be described in the next 2-3 slides. The idea is, I do good, but it is ratified by a third party so that whatever I have done is an honest review. So when I say that I save energy, somebody has to investigate it and prove that yes, you did really save energy. I save water, somebody says okay, fine. So that checking portion is done by the Engineering Building Council. There are several other rating agencies like GEM, etc. And the United States Green Building Council also does that. So these are some of the green hospitals which are there. You see the Max Super Specialty Hospital, Bhatinda, which is an IGBC gold rated building. What is the advantage of building a green building? You have enhanced daylight. Enhanced daylight means you have more visual connectivity to the outside world. Usually hospitals have become closed rooms where the patient who is lying on the bed cannot see anything else other than the fan above or the false ceiling and the lights above. Or maybe the television in front. He doesn't have access to windows. So that is why when you bring in daylight, you have more windows, the patient gets connected to the world outside. Improvement in the health and hygiene, like the previous session, Dr. Elizabeth said, happy patients recover faster. So it is important that you keep the patient happy and not worried. The moment you put a patient into a claustrophobic situation where he cannot see the outside world, he cannot see the sky, he cannot see the plants outside, he cannot see people, you are actually making him unhappy and insecure. And patients do not recover fast in such environments. You have to make patients feel happy, feel healthy. Then the recovery process is faster. Tangible benefits in terms of the material side is savings of about 30 to 40% on the cost and water savings and energy savings that follow. And that is a huge thing because as the competition levels in the healthcare industry also increases, it is very important that the bottom lines are managed. And for managing bottom lines in healthcare industry, you cannot but work on energy because nothing else can be compromised. The number of people in a hospital, the number of caregivers, the hospital staff, anything, HR side, you cannot compromise. So all you have to do is look at the profitability using savings. These are some of the buildings that are already certified long time back. More and more hospitals are getting certified across the country. We have now got more than 100 plus hospitals which have been certified. Some of them are listed here. You may be familiar with some of these. What are the key features of a green healthcare facility? Like I said, the healing architecture. It just means Aston Medicity has got very good rooms which are overlooking the backwaters. That's an excellent design in terms of therapeutic environment because you are having it connect. The visual connect is with the patient, not feeling as if he's in a bed. So daylight and connectivity is important. Colors. Whites are there in the mortuary and in the clinical rooms. So colors are very important. Colors have a healing touch. So these are things which experts have to advise, and you have to probably get into the idea of getting away from white, getting into some other thing. So that is the other part of healing architecture. Occupant and patient-centered design. How do patients move inside the healthcare facility? How easy is it for you to carry a patient through a corridors of the hospital? So that patient movement, how easy is it to transport the patient from one bed to another bed? From the bed to the X-ray unit, from the bed to the CT scan, from the bed to the MRI. How are you transporting them? All these things are verified in the certification process. Infection control, most critical aspect. Hospital-acquired infection. I don't know. There are several research papers on this. It's a very critical element, and this is one area where the air conditioning system works. What is hospital-acquired infection? One patient who is coming into the hospital with X disease goes back with the Y disease, or has to be treated for Y disease. How does this happen? This happens when the air conditioning in the system is not good. When the pathogen is allowed to travel from one point A to another point B in the hospital without being regulated. Hospital-acquired infection is a serious thing and that needs to be taken care of. So there are levels of filters. Sometimes, people compromise on the use of HEPA filters and all that. All those things have to be taken care of. Pressurization, wherever there are serious sick patients, those things are maintained in negative pressure. I think this screen is gone. Now, several mechanisms are available: antibacterial surfaces, purification using filtration technologies, etc. Some of which you may have seen, some of which you may be using, but extensive use of these things will help in controlling of the pathogen movement. Isolation room designs. 10% of the hotel inpatients have to be designed so that as isolation zones to reduce the risk of hospital-acquired infections. HEPA filters are there, filtration levels 99.9995. So these are things. On the right side you can see the Reliance Hospital Mumbai, which is an IGBC gold-rated building. Sanitation, design and cleaning practices, standard SOP in all hospitals. So these things have to be adhered to. There has to be written down operation practice code so that everybody in the hospital, starting in the last line, worker who is the sanitization assistant, to the nurses, to the doctors, everybody has to be aware of it. The protocols have to be aware. Frequent cleaning of the high-touch services, this happens usually, but the more the better. Biomedical waste management, now in Kerala, for example, there is Image which is doing a splendid job. So centralization is management facilities there. Automated solid waste management process in hospitals is recommended. We cannot probably say that we insist on that, but waste management in hospitals is a critical issue, and automated waste management helps in identifying and segregation of the waste. So the different colored bins, etc. I think NABH has helped in regularizing this to a certain extent, and the standardization of waste management is more or less in place. Water conservation, again, water efficient fixtures are being used, the regulation of water, the regulation of hot water, the regulation of flushing systems, all these things to do the net reduction of the water consumption in the hospitals, thereby reducing the sewage treatment plant capacities and thereby reducing our energy and water. Harvest rainwater to the maximum, it is free, it is available. So this, on the right side you see the Pune hospital, which is Ruby Home Clinic, which is an IGBC gold certified hospital. Energy efficiency I spoke about, so JV Noida. Renewable energy, so that's kind of everybody knows that now. Dependence on renewable energy, which includes the solar PVs, the big generators, all these things are now everybody's aware. So try to use as much of that as possible. Microclimate within the hospital, this is a very critical issue. Most of the hospitals are basically concrete structures with high mass concrete, which not only serves in increasing the urban heat island effect, but also it is an eyesore. So instead of doing that, try to make sure that at least 30-35% of the land area is converted into landscape. This green environment really helps. Plant more trees, have more plants, have more shrubs, flowers, etc. And that will help in the patient health also. Green education is following a protocol of having signages across. I think a lot of hospitals have this. So periodical awareness campaigns. June 5 is the World Environment Day. On June 5, most of the institutions across the world organize some event to promote the green awareness. This was the rating facility, green facilities rating code. There is a code which is to be followed. And holistically, these are the areas where we are trying to focus. Indoor environment quality and well-being being the most important. These are the certification levels. What you see is gold and platinum, etc. based on these scoring points. There is a process of project registration and then documentation and then a review by the IGBC team which leads to the rating of the project. So, to improve the profitability of healthcare institutions and to improve the patient care, it is important that you try to get the hospital certified as green. So any information, you can contact us. Thank you so much for the time. Enjoy the day.
Thank you, Ganesh. A lot of information on health facility management, green transformation, promoting healing, reducing hospital-associated infections, giving us tangible benefits like energy saving, energy efficiency, intangible benefits, daylight, health, hygiene, sanitation, patient-friendly environment, and also automated solid waste management systems, water conservation, renewable energy, heat island mitigation, something new which I learned, and green education. So summing up the points which you spoke, and we have the third speaker as online speaker. So in managing some of the JCI recommendations which are in the Global Health Impact 8th edition, it emphasizes on strong governance and sustainability tracking, empowering staff at every level where nurses come into play, greening the supply chain, very, very important for healthcare, and building resilience into the system for sustained green efforts. So green leadership will bring to life a few practical strategies. Form a committee, conduct environmental audits to identify area for improvement, set measurable goals. For example, reducing energy consumption by 10 to 15% year on year. Engage all stakeholders, including patients, family members, visitors, community partners. Promote green procurement. Buy from vendors and suppliers who share our value and goals. Support green commuting, carpool, cycling. In fact, many healthcare organizations have started carpool and cycling for employees. A great effort, I would say. There was also a study conducted by BMC Nursing in 2024, which was titled as Fostering Green Transformational Leadership, where 116 nurse managers participated. That includes significant improvement in environmental knowledge, adoption of eco-friendly practice, increased innovation, creativity and technology, sustained behavior changes, and this was over a 3 months period. So our third speaker is online. Over to Dr. Karan, our third speaker. I hope somebody is managing that.
Am I audible? Thank you. I will begin my presentation, but before I do so, I'd just like to first thank the organizers of ANEICON and Captain Ajita Nair, the President of ANEI, for inviting me for this conference. And my deep apologies for not being there in person. I was slated to fly in yesterday, but unfortunately came down with the flu. But I did not want to miss this opportunity of speaking with nursing leaders and the nursing workforce on the need for sustainability and sustainable action in hospitals. It's our firm belief that without the support and active participation of nurses, our goal of green healthcare is not only jeopardized but not possible. As Dr. Alex highlighted, he's spoken about the need for bringing in sustainable practices, and these are possible only through nurses who spend the maximum amount of time both with the patients but also understanding processes that most of us, especially nurse administrators, do not understand as much as we do. So that's why it's important to understand the subject, and thank you once again for having the subject being discussed. I will, over the next 15 minutes, bring to light sustainable technologies and innovations can look like for hospitals. And if you are starting out in your organization to look at sustainability or plans to build sustainable action, what are the approaches and what are some of the means that you can deploy? So I hope that you find this useful as you start your journey, but also if you are trying to lead to some level of maturity within your own sustainability program in your hospital. I will not repeat what has been spoken about by my esteemed speakers prior to this presentation, but I will be covering the need for green innovations in healthcare, look at the positive impacts that this can have. Why should we do it? What is the underlying need to do this? And then look at some approaches that have been attempted and how you could look at those within your own setting. So the need for green innovation, I think, was well established. Alex spoke about the impact that the health sector has on global emissions. Global emissions are causing global warming and also changes in the climate, which is being felt very acutely by across the length and breadth of our country, but across economies, across countries and boundaries. So this is a problem that goes beyond national borders. And healthcare sector and facilities contribute in large amount to those emissions because we consume a large amount of energy and also we generate a large amount of waste. And this is not just biomedical waste, but it is also things like wastewater that is discharged and also non-hazardous waste. So beyond what we do in the yellow and blue and red bags, even the black bags that we generate waste in, which may be non-hazardous, but is ultimately linked to the waste crisis that we see across the world. Now in India, this crisis has not reached epidemic proportions that we see in the West. Our consumption and waste generation in the health sector is minuscule as compared to Western economies and advanced countries. But please also be mindful that India currently does not have enough beds and health infrastructure to meet the needs of all our citizens. So as the health sector expands, therefore even this waste generation or emissions will continue to rise. Therefore the need to build in these practices today so that we can grow sustainability. And that's where green innovations can help reduce our carbon footprint and make us more effective in our approach. Now, what are the benefits of doing this? One, we know that within your hospital, you can create a healthier environment for patients, for visitors, but also for staff, because staff are people who are using this day in day out, patients coming home. Second, it actually does improve indoor air quality, which we know in a healthcare setting is very critical for the recovery of patients, especially critical patients. So if we take concerted action, it can help reduce the ambient air quality parameters and it become healthy for patients and thereby improving outcomes. And then as we move towards non-toxic materials, it helps both the staff but also it helps patients and the environment. Think about mercury. Till about a decade ago, mercury was found in multiple medical products and interventions, right from a BP apparatus to a dental filling. Today, we've actually moved away from mercury, and we've seen the benefits, both environmental and non-environmental. So these are some of the advantages that hospitals and the health sector can feel directly. Obviously, the benefits are much higher when you look at what it can do to reduce your carbon emissions, reduce costs, and so on. So as I said, apart from the health benefits, there are also economic advantages of investing in sustainable technologies. There are cost savings. Earlier, till about 10 years ago, the cost of solar power was in fact higher than coal or other conventional sources. Today, if you see, per unit of solar is actually lower than conventional energy generation needs. So there is a cost saving if you do this. If you invest in newer technologies like LEDs, not only will the lifespan increase, but even the cost of switching those lights on reduces over time. The other economic benefit manage your waste more efficiently. And this helps not only reduce our carbon footprint, but also the costs involved in managing waste. And we know that's a huge enterprise that any hospital has to invest in just the bags and the segregation activities, in training, and then the disposal. So that's a clear economic advantage. And then there are long-term financial benefits, as I said. As you reduce your carbon footprint, you're also going to be reducing your economic overheads. So as I said, there are these positive impacts that are felt both more systemically for your organization, but also when you look at very specific areas within the hospital. This was covered previously. Energy efficient systems help in reduction of the overall consumption. It lowers operational costs, like I said. And again, it has an environmental impact because you reduce the burden of your own facility, and therefore the community advantages are also felt. And as I said, the positive impact is also on waste and pollution. The community benefits are sometimes not fully understood. We know that the amount of wastewater, untreated wastewater that goes into the municipal supply actually has a runoff effect on both the topsoil and also water that seeps into our soil, and therefore then can lead to multiple issues, whether it is on food production, agriculture, and so on. So we have a wide-ranging benefit of these strategies. And also remember what happened during COVID. The amount of waste that was generated was invariably either burned or found to be disposed incorrectly. And both those caused a major community burden, as we've seen. And as I have already covered, the indoor air quality improves patients' outcomes. But here, it's also important to highlight that the patients are also asking, what is this organization, what is your healthcare facility doing to both become more sustainable and reduce the pollutants that are there within the operating environment. So if you want greater patient satisfaction also, you will need to look at sustainability and sustainable practices more holistically. I will now look at some of the approaches that you can look at to adopting green innovations. Now, when you are starting a sustainability program, it can start at both the facility level but also at the department level. It can even start in your ward. It can also start in a specific part of your ward. It need not be all in all. The idea is whatever is your scope of impact and area of operational control, please look at how can we build sustainable practices there, and then this can grow organically to get the entire facility involved. And the good part is that when you do that, the impacts will be felt across the organization. So this need not be just an activity that engineering departments do or housekeeping does, but everybody contributes towards this. This is like healthcare quality, where all of us need to make that contribution towards a larger goal of becoming more sustainable. But when you do so, you will first need to do a thorough assessment. My experience has shown that people want to have a good intent, want to start on their sustainability journey and start looking at things that they want to do, rather than first assessing what are my pain points, what are my current needs, how efficient is my facility to begin. So those are areas that you should be looking at very instantly. And then look at the impacts that you're already having and what innovations you can do on the ground. And with that, you need to then prepare a structured program which has clear goals, which identifies what are the resources that you would require to achieve those goals that you set out for yourself. Again, this need not be just an activity that you do within your own setting, but would require leadership at all levels, both nursing leadership, clinical leadership, and also your organization's managerial leadership. And then we have to make sure that we engage with stakeholders. Engaging with doctors becomes a challenge because sometimes they may be set in their own pace. But there are, I think if there is one influential cohort within a hospital, it is the nurses who can actually push the stakeholders to become part of this. You will need to ask for funding and resources. This is a definite ask, but I think something that more and more hospital leaders are looking towards, and then building community support about communicating what you're doing. let me now just come to a few interventions and innovations that you can think about. I'll cover about 6 topics here. So one is in green building, design and construction. Here you can look at sustainable materials which reduce the carbon footprint. You could look at natural ventilation and lighting. This is a good intervention to do, low cost in many settings, but also because of the way we have a hot tropical environment. Sometimes this natural ventilation and lighting is also beneficial for us in improving cross ventilation and reducing the need for electricity. Energy efficiencies I already spoke about, and water management. These are a few areas that you can also contribute towards with your engineering teams and your hospital leadership to improve the sustainability of your grid. Second is renewable energy. Again, this is not something that you directly impact, but it is something that you could be mindful of. We know that solar and wind today and also hydroelectric power are those sources with which you can purchase electricity directly from the utility provider, and this helps reduce the carbon footprint. We need to move away from fossil fuel as we all know, and these are now very credible sources of power, especially in the coastal regions. Wind is now becoming quite big, and in the north of India, solar has become quite big. And we know that in the hilly states, hydroelectric is quite big. So renewable energy is the second. Ask your engineering leadership how much of the energy resource is from renewables. It would be good to know what progress is being made there. Waste reduction and recycling is something that is directly both can be impacted and should be looked at by your community and hospital leaders because this is the biggest impact that we have. And again, it includes training, but also now digitization, because the law mandates that we should actually be barcoding each bag and seeing how much waste we are generating so that the records are in place. And using equipment in such a way that the waste generation itself goes down without impinging on patient outcomes. How can we make sure that we get into those practices? One thing that we found very useful is to quantify the amount of waste being generated per occupied bed per day. If you do that, then you can see whatever the amount you need, maybe 2 kgs or 1.5 kgs, can you reduce that to 1.4 or from 2 to 1.9, through a more conscious clean practice. And then there are sustainable materials and processes. We know single-use plastics and disposables have become a major crisis, especially after COVID. And this is also just the way the industry is now sort of made. It's pushing single-use and it's pushing a disposables culture. But we know that prior to COVID, we had very good practices of sterilization, which could mean that you could use materials again and again. And I think we need to go back to that good infection control and sterilization processes so that we reduce the amount of single-use and also disposables. And then there are some technological innovations that are happening. We know telehealth, a lot of your organizations might be involved in telehealth, actually reduces the carbon footprint because patients don't have to travel to your hospital or to get treatment. And that's a very effective way of reducing the economic burden of care, but also the emissions burden. And then we've all heard about things like AI, machine learning, and blockchain. These are actually helping us better identify what are the hotspots, where we are actually generating these emissions from, and what are the areas that we can impact on the maximum. And then, of course, as I said, we need green healthcare programs, but we need staff training and education. And capacity building, through means like this is very important, and we must spread the message, and we remain always available to help, engage the workforce to know what they can do to intervene and make that change in their practices. And collaborations and partnerships are important, this being one example of it, but wherever we can partner, because this is for a larger good, this has no business intention to it, but only one intention is to make, the practice of healthcare cleaner. So as I said, we know that sustainability is important, it needs to be done today and now. We need to embrace healthier environments, and a lot needs to be done both within the facility and the impacts outside. It improves patient outcomes as well. So while we heard a lot about what it does for the environment and community health, but actually can help improve patient outcomes. And it's our little contribution towards a sustainable future, which we need to ensure for our planet. planet and future generations. Just want to leave you with this thought from Robert Swan, who said that the greatest threat to our planet is the belief that somebody else will save it, that this is not my job, that somebody else will fix this. And I think everybody has a contribution to make towards the climate crisis and making healthcare more sustainable. You should identify what you can do, and within that realm of influence, do the best possible. Thank you for your time and attention, and my apologies once again for not being there in person. Thank you. Back to the organizers.
Thank you, Dr. Karan. A lot of things you spoke, technology, innovation, and we are creating through green changes, we are creating a future for our coming generations. I will ask Mr. Anil to sum up this session, please. Thank you.
Good afternoon, ladies and gentlemen. I wish this program of ANEI will give you some strong messages to take home. The top leaders of the healthcare sector has demonstrated how energy can be conserved in hospitals and healthcare sectors. And when they were saying that 5% of the carbon emissions, which is much affecting the environment, is from the hospital and healthcare sector, we need to be bothered. We cannot think that someone else will come and correct. You, being the major workforce, major pillars of the healthcare sector, as nurses and nurse leaders, I wish this kind of a seminar, this kind of a basic education program would give you a thorough insight of what has to be done and what has to be carried out in various organizations from where you are coming from. So to sum up, someone was saying about how, the first speaker was saying about how the nurses can be dominating. He was saying about switching off the light. In fact, when we were sitting there, we were not able to get that point. In fact, they were saying we could only guess what they were saying. But still, I am under the impression that they were saying about the utilization. I mean, whenever the fans and lights are not put in use, when the ACs are not put in use, that need to be switched off with the initiation from the nurses. And of course, reduction in various aspects such as utilization of alternate source of energy and optimization of water resources. All those were being highlighted, and where how the nurses can demonstrate it, how the nurses can initiate it, and how you can become a great leaders of the healthcare sector was about that. And of course, green buildings were the second highlight or the second speaker. We all belong to most of the hospitals from where you are hailing from, are not recently built, most of them. So you have to adapt certain methodologies, how it can be eco-friendly, how it can have more ventilation, how it can be environmental friendly and all that. So whenever we are making alterations in the hospital, you as nursing leaders must be able to say your insights as how it should be more patient friendly, how it can be more sustainable for the environment and for the patient enrichment. And then to sum up few of the points what has come to my mind and what I have noticed are the switch to safer and anesthetic agents like which are not hazardous to the environment, and improve energy efficiency with the LED lighting, smart HIV systems, and low energy medical equipment. When we talk about the medical equipment, you know, in most of the developed countries, they are pushing the medical equipment to our country, particularly to the third world countries. When they are having the threat of environmental impact due to the medical equipment, they don't keep the medical equipment with them. They make us to utilize the medical equipment which are being pushed to the such countries. So we should be aware of the fact that medical equipment must be having a lengthy life. And when Indian government was saying about the indigenous product in the healthcare sector, the government of India was trying to bring in this CT, indigenous CT, indigenous ultrasound machines, and so many indigenous equipments which were being brought from other countries like US, UK, and Canada, particularly Germany and all that. But unfortunately, we were not successful. So we should think of, our government of India should think of making such equipments which are eco-friendly, and all the healthcare leaders should support more of the government to make the products, the healthcare, indigenous equipments, particularly like CT, MRI, ultrasound machines, and, which are only imported from other countries. And we should invest in renewable energy, of course. It has been the all of the day. It has been there for many years. All the solar energy, wind energy, and all renewable energy, water usage, and all must be put into action again and again. And we should stress the need of it. US basic leaders must be able to impress upon the management and impress upon your leaders as how it has to be done. And the third one is conserve water. Of course, water is going to be a threat again. Yeah. So these are all the things what has been highlighted. To sum up, I wish this ANEICON message will strengthen your ability as nation leaders to bring in changes in the healthcare system. As initially said, 5% of this carbon emissions are from healthcare industry. We need to put an effort to bring it down and to help the citizens of the country to have better health. Thank you.
Thank you, Anil. Thank you, speakers, Dr. Alex, Ganesh, Anil, and Dr. Karan. So the green movement has already started. Let's be part of the green revolution. Let's not just keep it at ideas, but translate our green passion into action. Passion to action is the tagline of ANEI. ANEI has already set an example by going paperless today for the conference. Thank you everyone for listening.